Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
We are so happy that Dr. Usry, and you've heard him before, that's Dr. Kevin Usry, and he is the founder of American Wellness Centers, and we are going to find out so many things today. I can't tell you about his next article in the June issue yet. We'll save that. But one thing that Dr. Usry does really specialize in is peripheral neuropathy. And I wanted to ask you, well, good morning.
Good morning.
He always dresses so beautifully. We always take his picture and then we have to put it into our magazine. Is peripheral neuropathy really running rampant? Is that why you specialize in this?
Yes. I'm kidding. No one wants a guest with a one-word answer, do they?
That's okay. I can think of something to say, but I've heard of peripheral neuropathy because of people I know who've had chemotherapy, and that seems to be one of the results. But you're doing it not just from that, from just in general.
Well, my uncle had it, and this was back in the 90s, and they didn't even have the medications for that type of condition in those days. He developed it so severely, he began to have falls, which is the eventuality of all patients who have peripheral neuropathy. They end up falling. And he broke his hip, he had an embolism, and he passed in the hospital. And it really impacted me on how one event can really change a person's life. So I did some investigating, and at that time they weren't doing anything for it. They would recommend physical therapy, but all of the brain-based pain medications, they really weren't out in those days. So I started working in 1997 with a cold laser and a vibration machine, and the program has grown since to a number of different modalities that are all very successful in getting rid of peripheral neuropathy.
Okay, well, let's ask you, what does a patient say when they come in? What actually, I have read your articles, it's like they're numb, their legs are numb, their feet are numb. Is that part of it?
Numbness and tingling is certainly part of it, usually the beginning. And then it'll start maturing into pins and needles, on occasion burning. Patients tell me their feet feel like they have cement blocks on them. I feel like I have something underneath my feet. I can't feel my feet. These are people that are driving to my office, so and they're aware of it, and so that's a big area of apprehension. We don't have a good transit system in Florida, or at least in this area, so people have to use their cars, and when you can't feel the pedals of your car, that's threatening your independence, isn't it?
Yes, and so typically, how would a typical doctor respond to peripheral with neuropathy, with just medication?
Well, just like any good doctor, they take a history on their patient, and so their histories usually lead them to a large degree on where their thinking needs to go in terms of diagnosis of a problem, which has yet to be determined. So if they have diabetes, if, as you say, they've been on chemotherapy, if they're one of the 30% of the population that doesn't absorb their B vitamin, these are the people also who are on other medications, and some of their medications in and of themselves create the side effects of peripheral neuropathy. Well, these are the conditions that lead, or I should say, these are the problems and dysfunctions in patients that lead to this condition.
Well, take the words apart, peripheral and neuropathy.
Oh, sure. Well, peripheral means away from the center. So as far as you can get from the center, and in regards to where the center is, our heart, because this is our pump of our blood. So the problem is in the arterioles, the very tiny arteries, and the nerves are starting to starve. So the neuropathy, okay, it's a pathological condition affecting the nerves.
Thank you. That's it's funny. There are a lot of people, I don't ask questions like that because I don't know if they know the answer. But I know that you know answers, so that's why I felt comfortable. But we now have so many things that we can use, and you have like a toolbox. I always feel when you write, there's a toolbox that you have about what you can do. And you just talked about the cold laser, and then in your upcoming article, you talk about all sorts of supplements and all sorts of things. Bio, you do a lot of. In your article, it was a bioenergetic and a bio. I'm trying to remember
Yeah,
now.
bioenergetics, biomechanical, and biochemical. This is how our bodies our being exists, even down to the very minute cell. We have a cellular membrane. We have chemicals that go in and out of those membranes. There is an energy that are found in all cells that are keeping cells moving and functioning properly. Some people call it physiology. Some people call it chi. So we are energy beings. We have biochemistry that is necessary for our function. And we have a structure that holds all of this in.
You really have. How long have you been practicing?
33 years.
33 years, and you started as a kid, and you
That was my third career.
Oh, really?
Yeah, I was a paramedic for Broward County Emergency Medical Services. I went to nursing school and worked for several emergency rooms. But when I heard about chiropractic, I was sold.
And so but you put a different face on chiropractics actually, and I like that because I don't usually go to a chiropractor, but I've certainly been with them. And my mother her life was saved. She had what they used to call lumbago, and she didn't know what to do. But a very good chiropractor really saved her. And so I've had a lot of very good experience with other people. But and it's funny. There's some yoga poses that I've done for 25 years, which I think has been my chiropractic. Because I can raise my leg right now at my age way up high, and I have very strong muscles there, which affect my back. So I understand what it is to have strong, musculature, and to really take care of what you eat also. As I was telling you, I have an avocado every day because I know of the vitamins in it. And so if I ever have to go someone, you're it. I mean, I'm going to go to you because I just admire your knowledge and just the caring way. And he walks in and he's always dressed so beautifully. And I always say, and he's so kind. And I say, are you like this with your patients? He said, of course. And
well, let me put you on the spot a moment, Miss Finley.
Right, I'm in trouble.
Because what you said is kind of poignant. If I ever need you. So let me just digress a moment.
Oh, good. Okay, I got myself in trouble, right?
In the 60s, we had the false tooth generation.
The what?
The false tooth generation.
Okay, what was that?
Well, my parents wore dentures. My friends' parents wore dentures. Everyone wore dentures. Why is that? They didn't go to a dentist until they really needed him. And by the time they really needed him, they had to have their teeth taken out. And we're not talking about just my parents and my parents' friends. We're talking of millions and millions of people. The dentists slowly educated people like me who educated their children that prevention is the only way to go when you want to keep a healthy mouth. This is the problem in our country right now. The medical paradigm is you go to the medical doctor when you absolutely have to. You go to a chiropractor to stay healthy. You go in there without necessarily having symptoms. You go there for him to find out if all of the things biochemically, bioenergetically, biomechanically are functioning at 100%. Who wants to live less than 100%? Nobody. But some people find their medical doctor can't help them, which is good news because they're in the disease and pathology business. You get your money's worth from your medical doctor. You have some sort of disease and pathology, don't you?
Oh,
That's
this is good.
This is what they treat. And they treat a lot of it because there's a lot of disease and pathology. Why is that? We don't put enough emphasis on going to practitioners to keep us healthy. Go to the doctor when you don't have symptoms. That's crazy. Not with the dentist. We do that with the dentist.
You're absolutely right.
I believe women do it with the gynecologist.
I was just going to say that I have a gynecology appointment. So you're saying that what I should do, even though I feel good, I should come see you, and you will then put everything else in balance before something happens.
Absolutely.
Okay. You made your point very clear.
I'm glad.
Okay.
Very good.
That's good. I'm glad that I said it so that we got other people to think in the same way. So you see people who are well, and you see people who are not well.
True. That's my job, is to keep them well. And so maintaining their health is part of my contract with them, if you will. So we screen for things that people typically aren't looking for: fatty acid imbalances, hidden allergies and sensitivities, the function of Krebs cycle, whether there's a necessity for folic acid, B12, and iron. A number of things are screened every time a patient comes in, because we can't depend on just what the patient tells us. We have to look at their body. What does their body tell us? How are they doing chemically? How are they doing mechanically? How are they doing energetically? And for some people who can't figure out, what does he mean by energetic? Well, think of going to the acupuncturist. We go to the acupuncturist again to stay healthy. We can go there with symptoms, but we go to the acupuncturist to stay healthy. They were the original doctors that had that paradigm. We're in charge of keeping you healthy. If you get sick, we look bad. So if the paradigm were shifted in this country, we would have a lot less issues with our health. We spend more money than any other country, and we are not in the top 10 as far as the healthiest countries.
Yeah, it's true. This is wonderful. What a great conversation. And what you've just said, of course, you've written in your next article coming in the June issue. But so how, when someone comes in, explain how you find out what their requirements are or what they should be doing.
In general, or regarding the peripheral? Oh, in general?
Let's just say in general.
In general. Well, they come in, they fill out 2 pieces of paper, the typical application for treatment. But we have a systems review where they look at, well, what's your energy like? What's your digestion like? How are you sleeping? Any problems with your eyes? Any problems with your sinuses? Problems with elimination? Problems with digestion? How are your moods? How do you feel as far as your muscles and joints are concerned? How is your well-being? So we have all of these things that we can screen. That way we can focus in on where the patients may be having problems, what system may be involved. We're nothing but a conglomeration of systems. We have the musculoskeletal system, the reproductive system, our cardiovascular system, urinary system, all under the control of the nervous system.
Okay, so now let's say someone comes in and they don't really have anything that is strictly for prevention. How do you test them?
Well, we do a series of things. We look at their posture to see how the muscle and joint alignment is. We look at their ranges of motion. We do neurological checks to see how their muscles and tendons are functioning in regards to their nervous system. We do certain things such as blood pressure and pulse rate and respiration. We look at oral pH. We look at urine pH. We'll look at patients' balance. We look at how their muscles are functioning. As I told you with the biochemistry, we look at their fatty acid balance. We look for hidden allergies. We look for oxidation issues, which is the number one reason we age prematurely. We look for sugar handling issues, as well as insulin-related issues. Many people don't know that when you have started on that road to diabetes, the way you started was because of the sugary foods you've been eating over the years, your insulin levels have been high. But we typically don't check for those. In our office, we do, but that's not a typical medical test that's done. But you can have high insulin levels, and these cause problems like vasoconstriction, problems with our autonomic nervous system. So many of our patients who have this have high blood pressure. And it's really an insulin issue. and they're not seeing it because their blood sugar may be a little high, but it's not syndrome X, it's not pre-diabetes, it's not diabetes, so they're not that concerned, but they need to be, because that's one of the reasons they develop peripheral neuropathy. Those small, tiny blood vessels in the feet start to constrict and won't open up any longer.
Wow. Great conversation. Let me tell everybody again now. Dr. Dr. Kevin Usry is here, and he has his wonderful office in Lake Park. And if you want to call him for an appointment, 561-863-8779. Again, 561-863-8779. And his website is All American Wellness. That's a great name. allamericanwellness.com. So Dr. Usry, wow. And you've been practicing a long time. And you're an interesting chiropractor, because I always, I don't know, maybe the chiropractors do this now, but I always believed that a chiropractor would help you, if you have problems with your neck and your back, and that's it. I didn't know that they would go into what you have been talking about. I mean, you're really a holistic chiropractor. Is that the term that I would say, or are all chiropractors holistic?
Well, again, let's go back to the dentists. You have dentists that specialize in just doing one thing. They drill cavities, and they take care of general problems that happen to patients' mouth. Then you have the endodontists and the periodontists. And so you have different kinds of specialties within the dental field. It's the same in chiropractic. I'm a general practitioner. You have a lot of the pictures people have in their mind of a chiropractor is as a musculoskeletal practitioner. True. A majority of us are musculoskeletal practitioners. Some, that's all they do. Some do more eclectic approaches towards their practice. It's really what the practitioner is most comfortable with, because that makes the best doctor. I don't think there's one technique that's better than the other. It's what really the practitioner themselves kind of relate to. And again, not to repeat myself, but that's what makes them better doctors. And so the patient benefits from that technique just simply because the doctor is more in tune with what he needs to do. For me, it's applied kinesiology. I've been doing that for actually longer than I've been practicing, because I took it as a student. So I've been doing it since 1982.
I'm glad you brought that up, because I wanted to talk about that, applied kinesiology. And I don't understand anything about it or how it works, but I know what people have done with me when they do this. And it wasn't actually a chiropractor, or somebody else that tried that. And it was amazing. And so I think for people listening who don't know even what applied kinesiology is, why don't you explain what you can do with it and why that's possible?
Okay. Applied kinesiology was founded by Dr. George Goodhart in 1964. He and a group of doctors started doing research in regards to functions of the nervous system. They started using a book that was written by 3 different physical therapists called Kendall and Kendall. And what they taught was the art of muscle testing. And as time has gone on and we have a better understanding of functional neurology, muscle testing for people to get an idea or picture in their mind tests very similar the nervous system the way the medical doctors do by tapping your tendons. Okay, when you get that little reflex hammer hitting your patella, okay, well, the doctor is sending an electrical impulse when he taps that tendon. It goes up to your brain, the brain recognizes it and responds with a certain amount of movement of the tendon. How much movement of the tendon that occurs will give the medical doctor who's ever doing that reflex indications on how the nervous system is functioning. They either get no response, a normal response where you see the leg move somewhat, or a hyper response where the leg moves dramatically and stays in a locked position.
Which isn't good, is it?
No. So it does have different implications of how the nervous system is functioning. That's what we do with applied kinesiology. We put a certain amount of pressure on a muscle. The patient recognizes that pressure. They've been instructed to resist that pressure. As the information comes back from the brain, the muscle locks, and you have a basic locking mechanism. And it's not a strength contest. It's not a contest. It's a testing of that response. We send sensory information. Again, much like the reflex hammer is sending sensory information. It may be through nutrition. It may be through touching a certain area on the body. It may be putting a range of motion into the body. That's the sensory input. Now we look for the motor response. Well, how does that muscle respond? Does it stay locked when we test it? Does it not lock? So it's really X or O, kind of a binary answer, if you will, like a computer. Either yes, that's a go, or no, that's a no-go. And it gives the doctor insight to where problems may be occurring and gives us insight functionally to the nervous system. And that's what chiropractic's all about. We're nervous system specialists.
Wow, that wonderful explanation. This, of course, will be on YouTube, which is great because if you missed it or if you want to hear it again. But I still want to go back to questioning what happens. So the way it was is this supplement going to be good for you or not? How does your body know that? Because you put it in your hand.
No, you don't put it in your hand.
You do something. What do you do?
No, you put it in your mouth.
Okay.
Now, when you put it in your mouth, all of the taste buds in the tongue and the cranial nerves that supply the tongue have a neurological tract, if you will, a wire that leads directly to a part of the brain called the hypothalamus. This is where changes in the motor response of the nervous system will occur, especially if you have the appropriate nutrition. And so it's a great screening tool to whether you have something that's appropriate or something that's inappropriate. Now, there are other methods. Anyone who relies just on one testing procedure as a doctor isn't practicing well. We have to measure responses. So you don't measure the response necessarily with just a muscle test. You'll measure a response with an orthopedic test or a neurological test or a range of motion or a diminution of their pain on palpation. There are other methods we use other than just muscle testing. And muscle testing has, in some circles, gotten a bad rap because people who do it are not true kinesiologists, and that is something a kinesiologist should do. Just like someone would look at the doctor doing a deep tendon reflex. I remember years ago when we're learning how to do that. It looks like you're using a hammer and you're hammering, but you're not doing that at all. You know, it's a flick of the wrist. It's a percussion. On the surface, it looks like it's done one way, but when you try and do it that way, it doesn't work necessarily. And that's the same thing with people when they try and do muscle testing. Most of them don't really have a good understanding of what they're doing, and it's not done correctly, or it's done as a parlor trick, or something to amuse.
Parlor trick, yes.
And that is not it at all. It's a blasphemy of something that's very pure and very scientific. And unfortunately, you know, just like freedom of the press, we have freedom of action in certain circles, right?
Wow. Well, yes, but I love your explanation. You certainly are clear. I must say that about things because maybe it's been those places I've been where it's more of a, you know, not a game, but where you take a bottle of of supplements and it's true, and your arm doesn't go down or does go down. It does do something. Is it because of your mind thinking of it? Because it's not. I did not put this in my mouth. The supplement.
The response is purely neurological. Emotions will have very little to do with it.
Huh. Yeah, well, it is a, I don't, do you call it a science? It sounds like it is a science.
Oh, it's based on science. When you're going to school to be a chiropractor, to be an allopath, an MD, an osteopath, you all have to take science classes in college. You have a bachelor's degree in science. So your basic understanding of the specialty you're going into, whether it's the pharmacological aspect of osteopathy or medicine, or the more natural approach of chiropractic, it's all science based.
Well, it's interesting to hear you. I am sure that you have taught a lot of people a lot of things, and I hopefully you've taught other chiropractors how to be a holistic chiropractor. I know we discussed this here, but you are different, and before we run out of time, I really do want to thank you, and I want to appreciate what you do. And it sounds like I'll bet your patients never leave you. Once you get them in your web, they're there because you seem to. And are you a sole practitioner? You're it when someone comes?
No, my daughter practices with me. She's an
didn't know
acupuncturist.
that.
Yeah.
So she does acupuncture.
Yes, we're proud to have Dr. Heather with us since 2015, and she's definitely added a big plus to our practice.
I'm
We're very
sure.
fortunate to have her there.
My stepdaughter lives in Portland, and she is an acupuncture physician. She went through the Oriental, the college out there, and and the things that they can do, and so
It's amazing.
For you though, what was a dream come true?
Absolutely. I can't think of anything better than getting to work with my daughter.
It would be wonderful to have her come in next time with you. Would
We'll
you
make
get
sure
her to
we'll make
do
sure
that?
we do that. Yep.
That would be fabulous, and maybe we can get her picture in here too and talk about her once. Maybe you could write a column for us. Wouldn't that be nice?
I'll drop it in her
see
inbox.
if she would like to do that. Well, remember, you've been listening to Dr. Kevin Usry, and he is located in Lake Park, Florida, and you can call him at 561-863-8779, and the website is allamericanwellness.com, and you will be able to see this on YouTube, and we hope that you continue to do good for the people that you're working with. This was a very impressive radio show today.
Oh, well, thank you very much. Well, 62, and I'm planning on working till 85.
Only 85?
Only 85.
You have a deadline. Well, thank you very much, and we'll talk to you.
I appreciate it. Thank you for having me.